All right, let's dive into a technology that is quietly becoming one of the most powerful tools in any modern hospital: artificial intelligence. We're going to dig into Professor Sanjay Arya's research to see how a totally new kind of doctor is checking in. And this one's made entirely of code. So when we say a new doctor is in, what does that actually look like? You might be picturing some robot walking down the hall, right? But it's not like that. It's a huge data-driven shift in intelligence that's starting to shake up, well, pretty much everything about how we diagnose and treat illnesses. Let me start with a question that might sound like science fiction. What if your doctor could literally see the future? I mean, a tool that could scan your health data and predict an illness days, weeks, or maybe even years before you ever feel a single symptom. Well, that's not sci-fi anymore. That's the core promise of AI in healthcare. So, to be super clear, what are we even talking about here? This isn't about replacing doctors with robots, not at all. It's about smart systems that can kind of think like humans. They learn from enormous amounts of data, they can reason through really complex problems, all to help the human experts make better, faster decisions. And if you think this is some far-off, futuristic concept, just look at this chart. Back in 2018, less than 1 out of every 5 U.S. hospitals was really using AI. By 2025, that number is expected to explode to 80%. This isn't a slow crawl. It's a full-blown revolution happening in real time. And this isn't just hospital administrators pushing new tech from the top down. Check out this number: a 78% jump in doctors themselves using AI tools in just a single year. That's more than a trend, you know. That's a massive shift in trust. It means the doctors on the front lines are seeing these tools as an absolutely essential part of their work. Okay, so adoption is going through the roof. But what can this stuff actually do? What are these AI superpowers in the real world? Let's look at how this tech is already making a direct impact on patient care. Let's start in radiology, because this is where AI is an absolute game changer. It's like giving a radiologist superhuman vision. An AI can scan an MRI and spot a tiny tumor that's almost invisible to the human eye. It can take a grainy, blurry image and magically turn it into a crystal clear 3D model, all while making sure the patient gets the lowest, safest dose of radiation possible. It's about seeing more way earlier. And here's the part that'll really blow your mind. It's not just about helping out. In some specific tests, AI can already match, and sometimes it even beats, highly experienced human radiologists at making a diagnosis. Just let that sink in. The tool's precision can now rival the masters. Now, let's step into the operating room. Here, AI is involved from the very beginning to the very end. Before the surgery even starts, it's analyzing all the patient's data to map out the best possible game plan. During the operation, it's guiding robotic arms with a steady hand and precision that's just not humanly possible. And after, it's like a silent guardian, monitoring for any tiny sign of a problem. You know, creating new medicines is this incredibly slow, incredibly expensive process. While AI is basically hitting the fast-forward button. It can analyze millions of molecular combinations in the blink of an eye, which just slashes research time. It means we can predict side effects sooner and run clinical trials way more efficiently, getting life-saving drugs to patients faster than we ever thought possible. And this whole revolution isn't just helping patients, it's completely changing how we train our future doctors. I mean, imagine being a med student and practicing a super complex heart surgery in virtual reality. You can make mistakes, learn, and get real-time feedback from an AI tutor, all with zero risk to a real person. They're even using it for things like VR mindfulness programs to help doctors and nurses deal with stress and burnout. It's amazing. But you knew there was a but, right? With all this incredible power, this isn't just a simple, happy story of progress. We have to hit pause and talk about the real-world risks and the serious ethical questions that come along with it. This quote, wow, it gets right to the heart of the biggest fear. What happens to the human element? I mean, if your diagnosis comes from an algorithm, what does that do to the trust you have with your doctor? That human touch isn't just a nice little bonus. For a lot of people, it's a huge part of the healing process. And the practical challenges are, well, they're huge. Topping the list is a really thorny one: algorithmic bias. If an AI is only trained on data from one group of people, it could make dangerously wrong diagnoses for others. Then you've got the huge concerns about data privacy, the massive costs that could create a world of AI haves and have-nots, and even this long-term risk that doctors could become so dependent on the tech that their own skills start to fade. So it really paints a clear picture. The promise is this beautiful, seamless, automated system that just makes everything better. But the reality on the ground? It's messy. It means buying expensive hardware, paying for constant updates, and doing a ton of staff training, all of which can seriously throw a wrench into a busy hospital's daily routine. So where does all this leave us? It all points to what is probably the single most important idea to grasp about AI's real place in medicine. This isn't about a machine takeover. It's about forging a new, incredibly powerful partnership. And this, right here, is the key takeaway. The best way to think about AI is like a stethoscope for the 21st century. It's a seriously powerful tool made to boost a doctor's own abilities, to help them see more, know more, and act faster. But at the end of the day, it's still a tool. The human expert, with all their judgment, their experience, and their empathy, has to stay at the center of it all. Looking ahead, the potential is just breathtaking. We're getting so close to a world where we can predict diseases before they happen and literally design treatments based on your unique genetic code. But to get there safely, our wisdom has to keep up with the technology. We absolutely must have strong human oversight and clear rules to make sure these tools are used fairly and to protect every single patient. And that leads us to the big final question that we're all going to have to think about. As this technology gets smarter and smarter, and woven more deeply into our lives, how do we make sure that healthcare, at its very heart, always stays human?